Good afternoon. Today's date is Wednesday, April 19th, 2023. We'll be sitting in room 254 this afternoon with the chairperson to be announced. Thank you and have a great afternoon.
Minister, we're ready to start here. Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of estimates for the Department of Health. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for St. Patel.
Mr. Chair, I'm happy to have the opportunity to ask the Minister of Health a couple of questions this afternoon. I appreciate that the Minister will be able to answer the questions in the same manner that she normally answers our critic for health today. And so I wanted to ask the Minister a question specifically regarding healthcare for international students. This is a file that has been expressed to me very seriously from many international students who have expressed their concern for not having access to the public healthcare system, while many of them they are required to purchase private insurance at a pretty expensive cost to them. I know that they have expressed, the need to be put back on the public healthcare system since it was removed from them back in 2018. And so I would ask the Minister if she has plans or her department has plans to reinstate international students onto the public provincial healthcare plan.
The Minister of Health.
Thank you, Mr. Chair, and I thank the member for St. Vital for the question. I must redirect the member to the estimates. I think they're still upcoming for advanced education. That is where the mandate for international students and healthcare coverage resides. But in doing so, I also want to put on the record that I'm told that Manitoba has the lowest tuition rates in the country. And in order for a student to register here, an international student, they're required to have health insurance. So again, I will redirect the member for St. Vital to the estimates for advanced education, and just remind the member that we do have in this province amongst the lowest tuition rates in the country. And I spend a lot of time talking with students from the immigrant community, and they have shared that that is one of the reasons why they select Manitoba as their choice destination for study. And I did several programs myself, all out of University of Manitoba, and made friends with many individuals in my undergraduate, graduate, and postgraduate studies that were international students. And they always lauded Manitoba for having amongst the lowest tuition rates. So I trust that we will continue to see an influx of international students coming to our province. And again, I redirect the member for St. Vital to advanced education, where the mandate for international students and healthcare coverage resides. Thank you, Mr. Chair.
The member for St. Vital.
Thank you. I appreciate the minister's answer, but I'd like to get maybe some further detail regarding this, because this does impact healthcare outcomes for Manitobans. When we look at international students who, despite the tuition that the minister claims, which by the way has increased by 18% over the first 6 years of this government's mandate, despite that, international students pay, in some cases in Manitoba here, 3 times or more what domestic students pay. And on top of that, international students have to pay for private health care, which costs them over $1,000 per year. Now, what that means for international students, in addition to all of that extra cost, and in addition to all their studies, it means that by having private health care and not being on the public plan, that they do not have access to health care in the same way domestic students do, the same way other people who have grown up in Manitoba and are part of the public provincial healthcare plan do. When they go to access healthcare from service providers, they are often questioned about the validity of their health insurance. Sometimes that means that many of them don't seek healthcare when they should, when they ought to. When they go to healthcare service providers, they're often asked to pay up front for care before accessing service or seeing a medical professional. And in many cases, due to the complications with private insurance and with university studies and courses and being eligible, many of them, sadly, due to no fault of their own, fall through the cracks, which leaves Manitobans, people who reside here, people who are trying to set up a life here, people who are trying to come to a province where we're in desperate need of more people to work in our economy, more people to become skilled, more people to work in our labor market and be skilled and well-educated people in our labor market. In a place and at a time when we ought to be encouraging those people, I find it very concerning that this government has a policy which would enforce and mandate that they pay an extra $1,000 for private health insurance instead of having these people on the public healthcare plan. Not only does it cost them more and makes our province less attractive compared to other provinces in this country, it also means that the quality of care that international students get is often not on par with domestic students and the rest of us in Manitoba. And so when it comes to quality of care, which I think Manitobans would say is directly in the purview of the Minister of Health, when it comes to ensuring that Manitobans have access to good quality care and can do so without fear of reprisal or without fear of getting hit with tens of thousands of dollars a bill, if not hundreds of thousands of dollars a bill. What does the minister say to those people who are trying to access good quality health care when they are looking at a system where that treats international students so much different than domestic students?
The Minister of Health.
Thank you, Mr. Chair, and I do value the comments that the member is putting on the record today. Again, I want to start with redirecting him to advanced education that is responsible for the mandate for international students as it relates to healthcare. It's under their purview. The member states that the Department of Health provides healthcare services to all Manitobans. That is accurate. However, discussions with regard to the direction of the mandate on international students and their access to health service coverage rests in the Department of Advanced Education. It is under their purview, Mr. Chair. Now, if that department were to bring forward a proposal, bring forward a requirement to make those healthcare services available to international students, well, then Manitoba Health, as they do for other Manitobans, would provide those services. Again, the mandate on whether or not those services will be provided rests with, as I'm sure the member knows, because in the chamber, the questions are usually posed to advanced education. So, I'm not quite sure where the confusion is today. So I'm going to redirect again the member for St. Vital to the estimates for advanced education for the discussion about the mandate for providing international students with healthcare coverage. Thank you, Mr. Chair.
The member for St. Vital.
Thank you, Mr. Chair. To follow up on that statement from the minister, I'd like to state that, in my role as critic for advanced education, I've brought this issue up to ministers in the past. Previous ministers on multiple occasions and multiple previous ministers have, not clearly answered this question as to whether there is a plan, if there will be a plan, or if they support reinstating international students onto healthcare. That's the Minister of Advanced Education. And in some of those cases, they have redirected me to the Minister of Health. And so, again, we're seeing a system where this government is putting international students and causing them to fall in the gap between two ministers, a Minister of Health who seems to push it to a Minister of Advanced Education, and a Minister of Advanced Education who has in the past pushed it to the Minister of Health. Now, it's frustrating for me to again hear this pushback and this redirection, the minister to push it to another minister, when clearly it's a health issue and it obviously affects students. And so I can, of course, and I will plan to ask the Minister of Advanced Education this question. But I would also say that I think it's time we have a clear discussion between the two ministers to settle this issue to work for the best interests of international students. And so I would want to get assurances that the minister is confident, the health minister is confident I will actually get an answer to this question from the advanced education minister. And I'd also like to ask whether, if there is any other further confusion, redirection, that we work together between the Minister of Advanced Education, the Minister of Health, and myself to ensure that international students don't fall through the cracks again between government departments, and that we can together advocate for healthcare for international students. And so I'll ask the minister if she would be willing to provide some confidence for me that the Minister of Advanced Education will be able to answer my questions, and B, if that fails, sit down between the Minister of Advanced Education, the Minister of Health herself, and myself to discuss how we can improve the health care for international students.
The Minister of Health.
Thank you, Mr. Chair. I want to redirect the question. We are here today to consider the estimates of the Department of Health for 23-24, and I did scan the estimates document, and nowhere within the estimates is there a mandate or a line item that relates to costs for provision of healthcare services for international students. Again, for this discussion, I redirect the member of St. Patel to advanced education estimates to pose his questions and ask that we redirect the questions to the estimates for Manitoba Health for the year 23-24. Thank you, Mr. Chair.
The member for the Pas-Kamisak.
Thank you, Mr. Chair, for this opportunity. I wanted to ask the Minister of Health, last time I had the opportunity to ask you a question. It was regarding the Northern Patient Transportation Program. And when you had, I can't remember the figures that you used, but that you had said that your government had given a significant increase to this program. And I had replied back saying, yeah, but the rates remain the same. And also, too, I wanted to put on record as well, after the fact that I walked out of the room when we were done, that the reason why the government is giving more money to this program, because more and more services are no longer available in northern Manitoba. And I do remember I did get the former Minister of Health, Mr. Yeah, the MLA for Steinbach, right? Okay, and we were in estimates like this within the chamber, and I got him on record agreeing with me that, you know, if I know I keep on sounding like a broken record about the Paul Clinic, but I really wish it was built. You know, so folks like me don't have to travel. Just, you know, it's hard being a diabetic in the north. We had both agreed that the Northern Patient Transportation Program would have eventually, you know, halfway met, you know, like our costs, if you will, traveling in the north. I mean, traveling, having that clinic there versus Northern Patient Transportation Program, and the fact that, you know, you got to go on your own dollar and then get reimbursed weeks later. It doesn't work well with us, to the point where we reject, not reject, we have to sacrifice our health in order to, you know, not miss work for a few days and not look for a ride. There's even you know, a Highway 6 call out for rides just for medical. We have fundraisers for medical trips as well. And so I just wanted to know any future for getting this policy updated, because I believe it hasn't been touched since '95. And I know for a fact that things will change for us in the fall. And that's the first thing I want to jump on, is to look at those policies and make them reflect who we really are and what our needs are in northern Manitoba when it comes to accessing health care services and leaving home to do so. Egosa.
The Minister of Health.
Thank you, Mr. Chair. The member, we discussed this at one of the previous sessions, and I recognize this is very important to the member and to the community that she represents. And, you know, I do want to ensure that it's put on the record that during the time of the previous administration, the NDP government, the Northern Patient Transport Program was crumbling. It was underutilized because it was terribly underfunded. And our government took office. We more than doubled the funding of the program to $18 million. Now I'm told upwards of 20,000 Northern Manitobans, twice the amount under the NDP administration, are served every year. And we continue to make investments in the North. I'll just give one example. We have given $4.3 million for 37 additional nurse training seats at University College of the North. I've said many times $812 million will be used in the creation of a new intermediate healthcare hub in Northern Manitoba, which I'm hopeful will allow for Manitobans in the North to be able to receive care closer to home. And, you know, I certainly won't stand and say that more work doesn't need to be done. It does. It's about continuous improvement. But our government is committed to that, not just in other areas of the health system, but certainly in terms of the Northern Patient Transport Program. Thank you, Mr. Chair.
The member for Union Station.
Thank you, Mr. Chair. I'd like to start by following up with the Health Minister to see if she's able to provide us with a document she promised she would have her department undertake to provide the last time we met, the last 2 times we've met. Thank you.
The Minister of Health.
Thank you, Mr. Chair. There are a few items that were taken under advisement that are not quite finished yet in terms of the calculations and analysis. If the member would like us to table what we have so far, we can do that. If the member would like to wait until all the items are ready, we will have them all calculated and ready to go tomorrow. So I give the member that choice. Thank you.
The member for Union Station.
I'm happy to accept right now what the minister does have ready and available, and also happy to receive the remaining documents tomorrow. Does that work for the minister and her staff?
The Minister of Health.
Thank you, Mr. Chair. We will follow through on that request. Thank you.
The member for Union Station.
So just clarifying through the chair actually, or maybe through the clerk, those documents will receive them via you folks, or they'll send it to us? Okay. Okay. Okay, so I'm just seeking clarity, I guess. The documents that are going to be provided right now, the minister is saying she'll provide today. I'm guessing we'll be getting those via email correspondence later today? Or those that information verbally and as well by email correspondence?
The Minister of Health?
Thank you, Mr. Chair. Just excuse my ignorance, but we're virtual, so how do we table these documents, these items?
I am informed that there's two ways that you can do it, Minister. You can either have them walk down here to the committee room, or you can send them through a virtual or by email through the clerk's office here, through the clerk, attending clerk. So we'll leave it to you to decide which way you want to do it, if that's satisfactory for everyone. Thank you. Go ahead, Minister.
Thank you, Mr. Chair. I'll have someone walk them down, and we'll do the same with the items tomorrow.
The member for Union Station.
Thank you, Mr. Chair. I'd like to ask some questions now in regards to the announcement the minister had this morning, specific to the pandemic waitlist backlog. I am happy to provide the release if the minister needs it, although I'm sure, obviously, that the minister has knows the release inside and out by now. The minister indicated that the health system has been able to address some of the additional backlogs of waits for various procedures that came about during the pandemic. I've read the news release and I've read the details of the news release, but and I'm asking this because it's what Manitobans have been asking clarity around for many months now. And Manitobans want to know what the current wait lists are for those procedures. And so, given the minister made this announcement earlier today, provided a news release with those details, I trust that she already has this information handy and that the information she has is directly related to the content of her release. So can the minister advise us of the current remaining wait times and list them for us here in committee?
The Minister of Health.
Thank you, Mr. Chair. I thank the member for Union Station for the question. It gives me an opportunity to once again thank the Diagnostic and Surgical Recovery Task Force for the incredible work that they have been doing to address the immediate needs of patients, reduce in wait times, and get in procedures done as soon as possible. I do want to highlight and place on the record that the pandemic backlog has been eliminated in several areas, and they are cataract surgeries, CT scans, ultrasound tests, cardiac catheterization lab tests, pacemaker surgeries, pediatric neurodevelopmental assessment, urology tests, orthopedic surgeries, which exclude hip, knee, and spine surgeries, oral surgery and dentistry, and echocardiography tests. The pandemic backlogs have also been significantly reduced for cardiac surgery by 54%, bone density by 53%, pain management by 47%, orthopedic spine by 94%, and adult allergy testing by 66%. And some of those numbers that the member for Union Station is requesting, actually all wait times info, the volume of patients that are waiting and completed cases can be found on the online Diagnostic and Surgical Recovery Task Force website. They have dashboards there. The information can be searched by site. It can be searched by region. It can be searched by specific surgery or diagnostic tests. So a lot of comprehensive information is there, but I do want to highlight and repeat the words of Dr. Peter McDonald, who's the chair of the task force and the steering committee, that they're continually expanding the number of service lines. They're supporting through the efforts of the task force. And over the next 2 years, they're actually projected an additional 180,000 cases will be treated through these many initiatives. This work has been ongoing for some time now, since the task force was announced in 2021, and they continue to tackle the backlogs. It's a key initiative in getting more patients the treatments they need more quickly. So we tend to focus on numbers. We tend to focus on what we see on the dashboards, but behind each number is a Manitoban. It's their life. It's their quality of life. And so we need to be mindful of that numbers do not tell the story of the pain and the suffering that Manitobans are experiencing, that they have asked our government and myself as the Minister of Health to make available to them a suite of services, a suite of options. At one time, the members from the NDP caucus were calling on myself and our government to pay the fees for individuals who had gone out of province to receive care without approval of Manitoba Health. They said it wasn't fair that we were not covering those costs. And then we moved to make out-of-province surgeries available, and then we were criticized for that. So it's difficult to know what side the members of the NDP caucus stand on, because it changes from one day to the next. But I can assure Manitobans that we stand on the side of them receiving care in a timely manner, ensuring that what they've asked us for in terms of a suite of options, a suite of services is available. They want to be able to enjoy a good quality of life with their family members, their children, their grandchildren. The number of stories I've received in emails of individuals who had cataract surgery, who couldn't see. One person was a palliative care patient who had a short period of time to live and was able to have cataract surgery done so that they could see their family members for a final time through our RFSA process. I know members opposite might not appreciate that, but I know that patient and the family members that had an opportunity to be seen just before the person passed away was important. So we'll continue that work.
The member for Union Station.
Can the minister clarify, the information she's saying is readily available online? Can she clarify if that information is just specific to the pandemic backlog? Because what I'm asking for is the wait times for these surgeries and procedures and tests in their totality. So I'm not just talking specifically about the pandemic backlog. I'm talking about all of these procedures, surgeries, tests in their totality as a whole. And so can the minister please provide that information? What are the remaining wait times, and list them out, and not just specific to the backlog, I'm talking about as a whole. Thank you.
The Minister of Health.
Thank you, Mr. Chair. It is my understanding with, in response to the member's question that the information to be found on the dashboard for the Diagnostic and Surgical Recovery Task Force is the totality of the weights for the procedures, which includes pandemic and ongoing wait times. So it is a comprehensive list. Thank you, Mr. Chair.
The member for Union Station.
Okay, so I'm gonna accept the minister's response, although I think that, I'm not sure if it's just maybe a misunderstanding on what it is I'm asking. But I'm gonna move on and keep it within the same sort of umbrella of the questions I'm asking, however. So there's a second list of procedures in the news release that the minister claims they've made progress on reducing the waitlist backlog from the pandemic. And so I'd like to ask the minister whether she has estimates for when the remaining backlogs for those procedures will be completed. And I'll give an example just to make it really clear. So for an example at the current rate, we're talking about cardiac surgery. So when, for example, would the cardiac surgery backlog from the pandemic be addressed? So again, this is a separate list now. It's a second list of procedures that were in the news release. And so cardiac is just one example, but we know that there's a wait list for cardiac surgeries that is, beyond the pandemic wait list. We know that, pre and post pandemic, if we can say that, there were wait lists associated with cardiac surgery. And so I'm wondering if the minister can provide clarity in terms of that second list of procedures in the news release, if she can provide clarity as to whether or not she has estimates as to when those remaining backlogs will be completed.
The Minister of Health.
Thank you, Mr. Chair. I will not speculate on information that is in a news release or with regard to the question the member raises. What we're here to discuss is Budget 2023 and the supplement to the estimates of expenditure for 2023-24 for Manitoba Health. And I'd like to redirect the member for Union Station to the estimates and the process and to the supplement, and happy to answer any questions there. And lots of time in what we call question period to raise some of those matters. Today, I would like us to focus on the supplements for Manitoba Health for 2023-2024. Thank you, Mr. Chair.
The member for Union Station.
So I raise this question because the minister does have a budget line around this. The minister has set aside millions of dollars to address the backlog. And this list of procedures that people are still waiting on, obviously is on the receiving end of those investments, of those dollars. And so one would imagine that if the minister has set aside a certain amount of her budget to address these backlogs, then the minister would have some sort of awareness as to what the hopeful timeline is in order to make sure Manitobans get access to these surgeries and these procedures, cardiac surgery just being one example. And we know how important it is that folks receive that care. So I ask this because the minister in her own budget does have funds allocated to addressing this very important issue, this essential healthcare issue. And so I would imagine that she does have some sort of a timeline in mind in terms of when this second list will be addressed.
The Minister of Health.
Thank you, Mr. Chair. I just want to highlight the good work that has been done by the task force overall. So 14 service lines have been eliminated with the $110 million that was budgeted for 2022-2023 fiscal year, with 19 remaining. The budget is $130 million in the estimates for 2023-2024. In terms of cardiac, I see that 95% of the cardiac wait list has been eliminated, and 7 service lines are 50% eliminated, and surgeries continue to be done. When we look at cardiac, I'm looking at, I believe this is for the week of April. I don't want to get it wrong because I'll be questioned on it, but I think it's April 3rd, April 3rd to 9th, 2023. 18 cardiac surgeries were performed April 3rd to 9th, which is, and 12 cardiac surgeries were non-urgent elective, while 6 were emergent. And there were 20 cardiac surgeries performed during a similar period in 2019, where there were 17 non-urgent elective and 3 emergent. So you can see the increases and that these surgeries are being done. And, you know, I just want to look at, I have an updated document for surgeries as of April 13th by site, and Concordia Hospital is operating at 171% of pre-COVID capacity. Grace is at 94% of pre-COVID capacity. HSC is at 78%. Pan Am is at 500%. St. Boniface is at 118%. Cardiac, again, 200% of pre-COVID capacity. Victoria Hospital is at 100%. HSC Women's is at 300%. Mr. Chair, this is just incredible work, and it is my hope. Again, I always say this in every opportunity that I get, that we must remember that every number represents a Manitoban who's waiting for care, and we want to ensure that we continue to offer that care as quickly as possible. That's why our government continues to fund at record levels the work of the Diagnostic and Surgical Recovery Task Force. And you can see the increase we've made in the 2023-2024 budget. We've increased those dollars to $130 million because we want to chip away at these wait times as quickly as possible. So it's always my hope that they'll be eliminated immediately and very quickly. And I sit and have discussions with the health system leaders about how we can do that. Is it by expanding clinic hours? Is it by adding more surgery slates? How willing are our surgeons to work evenings or weekends or add additional slates? So discussions are always underway and changes are always being made. There's a lot of flexibility right now in the system to scale up and to do more. And we leave the door open to have those discussions on how we can do that. And again, in terms of cardiac, as quickly as possible. And I know the surgeons feel the same way. They are working, you heard the list that I read into the record of, like, some of them at 500% more than pre-COVID levels, 200% more. So they are working very hard, and I appreciate the good work that they're doing and value and appreciate everything that they bring to our healthcare system to ensure Manitobans who need cardiac surgery are receiving the care in a timely manner. Thank you, Mr. Chair.
The member for Union Station.
Okay, so I'm going to carry on with this line of questioning because it is really important. I'm talking about the second list on that release. So cardiac surgeries, bone density, pain management, orthopedic spine, adult allergy testing. And they've been reduced, as per the minister's own release, they've been reduced in terms of the pandemic backlog. So for cardiac, and I'll keep giving that as an example, has been reduced by 54%. And so I'd love some clarity here in terms of what does that mean in real numbers, real Manitobans who are still waiting for these surgeries and procedures and tests. And so cardiac surgeries, bone density, pain management, orthopedic spine, adult allergy testing. We have in the release the percentages of the pandemic backlog that have been completed. Can the minister clarify the percentage that has not been completed in these areas? How many people is reflected in those numbers? How many Manitobans does that represent in all of these areas where there's a percentage outstanding that have not yet received this care? And again, that's just specific to the pandemic backlog. Now, my follow-up question to that is, what does that mean in terms of the total number? So the folks, the Manitobans who are still waiting for cardiac surgery and are on that wait list, not as a result of the pandemic. Same for bone density, pain management, orthopedic spine, and adult allergy testing. So I'm looking for the number of Manitobans who are still waiting for these surgeries and procedures and tests on that second list because they're part of the pandemic backlog that has not yet been cleared. And then I'm also looking for the number of Manitobans overall beyond that pandemic wait list who are still waiting for these procedures. Does the minister have those numbers available?
The Minister of Health.
Thank you, Mr. Chair. I want to start by reminding the member of the excellent announcement on March 23rd as I stood with several health system leaders to announce the expansion and enhancement of the pain care program, and our government's investment of $4 million. It's an annual commitment. It's not a one-time commitment in investments to the Manitoba Pain Care Program. And at that time, I said that chronic pain management is about putting the patient at the center of their care by giving them expanded and faster access to multidisciplinary treatments. What was really, I mean, it was all exciting, but extra excitement was that the Manitoba Pain Care Program, which will include a new pain care clinic at Selkirk Regional Health Centre, which will ensure care is available throughout the province so patients can receive a more comprehensive pain recovery path. The first phase, the existing locations will schedule more patient appointments and perform additional procedures while recruitment is underway to add staff and clinical providers such as psychologists, physiotherapists, and kinesiologists to an existing multidisciplinary team. And I also talked about, how we're going to incorporate psychologists and other health providers in this multidisciplinary team. And Dr. Chris Christodoulou, who's the provincial medical specialty lead for anesthesia, who's also a member of the Diagnostic and Surgical Recovery Task Force Steering Committee, said he was excited at the opportunity to build a comprehensive pain care program to serve all Manitobans, both today and into the future. I also want to take the member back to the dashboard on the task force's website, which includes detailed data on wait times, including waits by weeks, number of patients on the wait list, and cases completed, and some examples of numbered patients on the wait list for knees: 2,346, hips 1,002, ultrasound 18,923, cardiac surgery 128, cataracts 6,318, bone density 3,249, completed through the task force. Knee surgeries 3,169, hips 2,399, ultrasound 229,458, cardiac again 1,126, cataract 16,581, and bone density 9,636. So a lot of great work is being done. And pain management isn't just about individuals who don't need surgeries. It is, as I said, about individuals who have overall generalized pain. Some it's due to rheumatoid arthritis and other conditions, but the pain program and the $4 million annual investment that we've announced will certainly help with the care that these individuals need. Again, just very excited and thankful to the task force, the leaders such as Dr. Chris Christodoulou, the psychologists that were there that day during the announcement, Dr. Charles Penner, who's the regional lead of medical services and chief medical officer for Interlake Eastern Regional Health Authority, was there, provided supportive comments for the work that our government is doing through the Diagnostic and Surgical Recovery Task Force. It's supported by experts from across Canada. The team of respected local healthcare professionals identify and implement short and long-term solutions. And you can see how those solutions are working for the various surgeries that I've listed, Mr. Chair. Thank you.
The member for Union Station.
The minister's press release says they've cut the pandemic backlog by a third, or approximately 26,000 cases. Can the minister confirm that that means there's still a backlog of some 50,000 procedures that were not performed during the pandemic?
The Minister of Health.
Thank you, Mr. Chair. So I know at today's announcement, there was a comprehensive update provided, and I'm certain I haven't had an opportunity to see the recording of that, but I know that Doctors Bushell and Mateer and McDonald are very excited about their ability to, since the task force was announced and we started with a block of surgeries and diagnostics, they would have shared how they began to expand that list to include other wait lists. And they and myself are very excited about the expanded mandate for the task force and their ability to help more Manitobans get the care they need quickly. And so the mandate has been expanded, and our government is following suit by ensuring that we make the investments that are needed financially for them to continue to provide care to Manitobans. So the budget is up from 110 million in the last fiscal year to this year's estimates of $130 million, which just speaks to the success of the great work that is being done. Thank you, Mr. Chair.
The member for Union Station.
I'd like to ask the minister about the recent news that her wait times task force is, and it's pretty serious news, that her wait times task force is rejecting offers of help within our public system and insisting on private sector involvement, even when we have the capacity that just simply needs, some investment, some support from this government. That's a pretty serious statement and information that was brought forward by specialists who resigned from the task force. And I'm sure the minister is, concerned and taking that very seriously, as all Manitobans who heard that news this week, I think, were pretty stunned by that revelation. And so we know that funding has been allocated to this government's privatization approach to different aspects of healthcare. And I'm wondering if the minister can clarify a discrepancy for me. There's a discrepancy in the number of tests that Cerebra has provided. So can the minister clarify if it was 158 tests or was it 237 tests? And why wasn't it the 1,000 that they promised?
The Minister of Health.
Thank you, Mr. Chair. I want to ensure on the record that the work of the task force is outlined, and due to the efforts of our government and the task force to date, 22,335 additional Manitoba patients have received their procedures through the task force's request for service agreement. In the last year, we've completed 89,378 MRIs, 264,849 CT scans, 1,026 cardiac surgeries, 2,182 orthopedic hip surgeries, 2,878 orthopedic knee replacements. The pandemic backlog for cataract surgery has now been fully eliminated. 15,251 completed procedures in 2022. We have halved the pandemic backlog for ultrasounds from almost 4,500 procedures to under 2,000. The Maples Gynecology Program has now provided dozens of successful procedures to Manitoba women. St. Boniface General Hospital has added an additional 8 outpatient cases a week and will be reducing the endoscopy backlog by 416 cases per year. FIT tests continue to reduce the endoscopy waiting list. 1,055 patients have been diverted from the waiting list, exceeding our goal of 1,000 patients for the year. Over 12,000 Manitobans have received successful surgeries at private providers in Manitoba over the last 2 years through the task force. All of these people would never have had their procedures done under the NDP if the providers like Maples or Western didn't exist. Of those, over 4,500 were done in the last 8 months. We expect an additional 13,000 surgeries and procedures will be done at Manitoba private providers over the next 6 months, making a huge impact on the backlog in addition to what the public system is doing. These number of people who have received a successful surgery successful surgery prove how detrimental the ideology in healthcare can be under the NDP. They would still be waiting in pain. Every other province has built up their system capacity in a balanced way over the last 25 years. It allows a province to access capacity at home when something unexpected happens. It is the main reason why Alberta and Ontario have handled their backlogs so successfully in their provinces. And again, I want to emphasize that government, not the patient, pays the bill. And we are supporting the public system, Mr. Chair. $4.9 million invested into a 5th operating room at Concordia Hospital to increase orthopedic surgery capacity by 1,000 procedures a year. $141 million to triple the size of St. Boniface's ER. $50 million to increase Health Sciences Centre surgical capacity by 25%. $30 million to increase ICU bed baseline from 72 to 100. $2 million for the Swan River CT scanner. $800,000 for 30 new nurse training seats at Red River College Polytechnic. $8 million for the new HSC acute stroke unit. $2.5 million for the cancer care redevelopment for chemo treatment in Russell. $812 million for the clinical preventative services plan. $1.2 million for the expansion of the physician and triage program at HSC St. Boniface. $750,000 for the HSC Children's Hospital inpatient monitor upgrades to support 26 beds. And Mr. Chair, I have to say that the $812 million is going to add 90 beds at Portage La Prairie Hospital, 60 beds at Hospital in Neepawa, 30 additional seats at Brandon Regional Health Centre, 23 additional beds in Steinbach, 24 beds at Boundary Trails, 30 beds at Selkirk Regional Centre, 12 beds at Lakeshore General in Ashern, These are dollars that are going into the public health system in a balanced way. Thank you.
The member for Union Station.
So my question was very straightforward. Wasn't a lot in it. It was very clear. And I don't really understand why the minister is doing everything she can to avoid answering a really straightforward question. I did mention previously, and I'll reiterate it because I do think it's important, that specialists on this minister's task force resigned and made that public this week. And the reasons for doing so are very concerning. Their reasons include that they brought forward a solutions which would have seen the backlog cleared in just a few years, solutions that would have strengthened this aspect of healthcare in the public healthcare system. And their solutions were rejected by this government for not having enough private sector involvement, which I've heard from a number of folks in the community who said very pointedly to me, wow, like you folks have been talking about this, you've been talking about this government's privatization agenda in terms of healthcare, despite tons of evidence over many decades that show that that's the wrong approach to healthcare. But to see it plainly from specialists who have resigned, that's really unnerving. And it's the folks who have reached out to me to express that really saw that as a huge red flag in terms of what this minister's approach is to healthcare. And so when I ask questions about the number of tests that Cerebra has provided, just asking clarity, it's a simple question, and the minister will spend 5 minutes avoiding providing a direct response to this question. I think it really highlights the concerns that Manitobans are bringing forward. And so I would ask again that the minister just provide simple clarity here. How many tests did Cerebra provide? Is it 158 or is it 237? And why wasn't it the 1,000 that they promised?
The Minister of Health.
Thank you, Mr. Chair. The member for Union Station continues to put inaccurate information on the record, which is unfortunate for Manitobans. The Diagnostic and Surgical Recovery Task Force confirmed this morning when they did their press conference that 2 physicians that were not officially part of the Diagnostic and Surgical Recovery Task Force. I want to say this again for the record. The 2 physicians were not officially part of the Diagnostic and Surgical Recovery Task Force. They did not resign from the task force. They did provide advice to the task force as members from the Misericordia Sleep Disorder Center. They have stated they no longer wish to do so. That is their right, Mr. Chair. We respect that. And we thank them and value them for the input they've given thus far. There are a lot of stakeholders, there are a lot of health system leaders that provide input to the task force. At times, their views will be acted upon, and at times it may not. But we value all the input that is received. And again, I ask the member for Union Station to discontinue putting these accusations that are not supported by the task force or by any information that has been tabled onto the record. These individuals were not officially part of the Diagnostic and Surgical Recovery Task Force. Mr. Chair, the task force estimates that the number of patients in Manitoba requiring sleep studies could be as much as 24,000 patients. Due to the limited access to the provincial sleep study waitlist, the flow of patients to the request for supply agreement was compromised, resulting in a negligible impact on the number of patients waiting for assessment. The proposal that has been put forward by the Sleep Disorder Center is under review. I know the members opposite have tried to tell Manitobans that it was denied, it was canceled, it was not supported. That is not factual, Mr. Chair. It is under review. A decision has not been provided. And I encourage the SDC, the Sleep Disorder Center, to await that decision, and for, again, the members opposite and the member for Union Station to cease from putting information on the record that is not substantiated by any facts. The Cerebra was contracted to conduct the sleep studies and provide reports to the Sleep Disorder Center for analysis and treatment planning through the request for supply arrangement process. It was announced this morning at the press conference that they've completed 150 sleep studies by March 31st, 2023, when the contract expired. Mr. Chair, the task force continues to work with service delivery organizations and providers through the RFSA process. The goal is to ensure the Manitobans requiring sleep studies, which I said before, for the record, could be as much as 24,000 patients, receive access to their sleep studies and the care they need in a timely manner. It requires a balanced approach. I hear on a regular basis from Manitobans who want quick access to care. They've asked this government and myself as minister to provide them with a suite of services and options. And we answered that call. And again, at one time, the members opposite, the NDP caucus, was calling on our government to pay for out-of-province care that individuals had accessed without approval from Manitoba Health. Now it's available, Mr. Chair.
The minister's time has expired. The member for Union Station.
Can the minister advise us if her government has directed that private sector involvement was a precondition for approving plans or proposals to address wait times?
The Minister of Health.
Thank you, Mr. Chair. The answer to the question is no. Thank you.
The member for Union Station.
What's the current status of the stroke unit at HSC? Is it open yet?
The Minister of Health.
Thank you, Mr. Chair. I'm pleased to report that all construction has been completed. The manager has been hired. Physicians have been hired. We're waiting for their arrival here in the province and look forward to a ribbon cutting ceremony very, very soon. Mr. Chair, again, let's remember that this is about individuals who need stroke care. And we have been very committed over our time in office to ensuring that stroke gets the attention that it needs. We made the investment into the stroke unit We are hiring the staff. It's been a difficult time, as we all know, in terms of the global staffing shortage. Again, the manager has been hired, the physicians have been hired, and we look forward to imminent opening. Thank you, Mr. Chair.
The member for Union Station.
There were several questions that I asked today that were, again, very straightforward and would have been great to get clear responses from the minister and, generate concern when the minister spends an exorbitant amount of time dodging and diving and avoiding answering these very direct questions. And, we continue to see specialists and experts and frontline providers in our healthcare system raise concerns about this government's approach to healthcare in Manitoba because it has a direct impact on Manitobans who are depending on it. And while it is incredibly disheartening that the minister did not answer my questions, there are other opportunities where I'm going to hold her accountable.
The time being 5 p.m., committee rise.